think it's important to understand that majority of patients who have COVID-19 have a mild illness and can really benefit from home care. It's a better environment than in the hospital, and your quality of care, both mental and physical, is going to be much better. So I would really say that once you are going in for home care, two or three things are very important. First is whether you have the capacity at home to really isolate yourself properly. And there are guidelines which have come up by the Indian government in terms of having a separate room with an attached toilet and how the caregiver should look after you so that you are not responsible in spreading the infection to your near and dear ones. So please follow those. And if you are having the capacity to really look after yourself at home, then home isolation is something that we would advocate. But you have to really monitor yourself closely, stay in touch with your doctor or to the doctors who call you in terms of fever, in terms of breathlessness, in terms of your saturation, if you are given a pulse oximeter. And if you have any symptoms that you feel is abnormal, you are not feeling good, please do consult your doctor. But supportive treatment, staying at home, isolating yourself at home will help in breaking the chain of transmission, preventing the infection from spreading to others. And in majority of cases, you will become all right by just looking after yourself at home. So while you're at home, there are two or three very important things. The first important thing to understand is that really what works is symptomatic treatment. So take your medication if you have fever, like paracetamol, keep yourself well hydrated, and take a good nutritious diet. Those are the important things to keep in mind, and monitor yourself closely. There is really no evidence to suggest that many of the drugs which are available in the market really are of much benefit, and you will become all right by just symptomatic treatment and taking drugs for fever and the other supportive management that is required. But watch out for the red flags. If you feel breathless, if you find that your saturation is dropping, your pulse oximeter is showing a saturation of less than 93, closer to 90, or you find that you're becoming drowsy, the caregiver finds that you're not responding that well, or there are any other symptoms that you feel are a cause of concern, please immediately contact your doctor because you may need to really come into the hospital. Also, if you have comorbidities like diabetes, heart disease, then monitor for all of these. Monitor your blood pressure if you can, monitor your blood sugars, and make sure that they are also under good control because that is also very, very important.
If you get symptoms of COVID-19, headache, fever, muscle ache, then you should get tested. And if you have a positive test, you need to isolate at home. You need to isolate at home to ensure that others around you do not develop the virus. When you're at home, you need to make sure you take plenty of fluids to ensure you remain well hydrated. You can use drugs such as paracetamol and ibuprofen to help the muscle aches and pains and to reduce the fever. But you must follow the instructions for these medicines so you do not take excess amounts of paracetamol and ibuprofen. It's an opportunity to make sure you look after yourself, and you look after yourself in terms of the red flag clinical symptoms. If you become breathless whilst walking up the stairs and take over 2 minutes to recover, if you're breathless on walking to the toilet, if you're breathless lying on bed, you should seek medical attention and medical advice. If you find yourself becoming a little bit more confused intermittently, you must seek medical attention and medical advice. All of these factors will help you to look after yourself so that you know if and when it is important to go to the hospital. Most patients who contract SARS-CoV-2 will not have a significant illness. Most patients can be managed at home. There are fewer patients that end up going to the hospital and even fewer still that go to the critical care. But we need to get the timing of any treatments right if you show progression of the disease from the virally unwellness that you'll have moving forward to the inflammatory response that will be triggered by the virus.